All right, welcome everyone. Today we're going to dive deep into one of the most fascinating and, let's be honest, complex joints in the entire body, the knee. We'll start by breaking down the joint itself, piece by piece, and then we're going to flip it around and explore the popliteal fossa, that really important space right behind it. Now, if you're in the health sciences, this is the kind of stuff you absolutely have to know cold. So let's get into it.
Okay, so here's our game plan for today. We'll kick things off with a basic intro to the knee joint. Then we'll get into the shock absorbers, the menisci, and the stabilizers, which are the ligaments. From there, we'll head to the back of the knee to check out the fossa, and finally, all the important stuff running through it. Pretty straightforward.
All right, Section 1, a quick introduction to the knee. Let's start with the absolute fundamentals. What kind of joint are we even dealing with here? Its classification really tells you a lot about its job.
So, the knee is officially classified as a hinge synovial joint. What on earth does that mean? Well, the hinge part is pretty intuitive, right? It works just like a door hinge, swinging back and forth. That's your flexion and extension, bending and straightening your leg. But the synovial part, that's where the magic happens. It means the whole joint is wrapped up in this capsule that's filled with synovial fluid. Think of it like high-tech motor oil for your body. It lubricates everything so it all moves smoothly with almost no friction. And here's a great little fact for you. It's actually the largest joint of its kind in the entire human body.
Okay, so we've got this big, well-oiled hinge. But think about the forces that go through your knee every single day, walking, running, jumping. What stops the bones from just grinding against each other? That's where these guys come in, the meniscus. They're basically the knee's built-in shock absorbers.
Now, you've got two of these menisci in each knee, and they're not identical. It's really important to know the difference. Your medial meniscus, that's the one on the inside of your knee, is kind of C-shaped. The lateral one on the outside is more of a circle, more of an O shape. But honestly, the shape isn't the most important part. The absolute key takeaway here, and you really need to remember this for exams, is that the medial meniscus is physically attached to the medial collateral ligament. The lateral one? It's free. And that one little detail, well, it changes everything when it comes to injuries.
So why does that attachment matter so much? Well, think about it. When your knee twists suddenly, the lateral meniscus, the one that isn't tied down, can actually slide a little bit. It can kind of get out of harm's way. But the medial meniscus, it's stuck. It's tethered to that ligament, so it has nowhere to go. And that's exactly why it gets torn so often. It gets trapped and crushed between the femur and the tibia. It's a classic setup for injury.
All right, so we've covered the cushions. Now let's talk about the things that actually hold the joint together and keep it stable. We're talking about the ligaments. You can really think of them as these incredibly strong, fibrous ropes that lash the bones together and prevent them from moving in ways they're not supposed to.
And we can break the main knee ligaments down into two really simple groups. It makes them much easier to remember. You've got the collateral ligaments, which are on the sides of the knee, and then you have the cruciate ligaments, which are deep inside the joint itself. They're called cruciate because they actually cross over each other in a big X.
Let's start with the collaterals. You've got the MCL, the medial collateral ligament, on the inside, and the LCL, the lateral collateral ligament, on the outside. Their whole job is to provide side-to-side stability. They stop your knee from buckling inward, that's what we call a valgus force, and they also stop it from bowing outward, which is a varus force. So they're your side-to-side protectors.
Okay, so the collaterals have got the sides covered, but what about stopping the bones from sliding forwards and backwards on each other? That's a totally different kind of stability, right? Well, that's the job of the cruciate ligaments.
And here's the star of the show, the one everyone's heard of, the ACL, or anterior cruciate ligament. Its main function is to stop your tibia, your main shin bone, from sliding too far forward underneath your femur. You can think of it as the main brake that prevents that anterior or forward movement. And of course, if there's an anterior one, there's got to be a posterior one. The PCL, the posterior cruciate ligament, does the complete opposite job. It stops the tibia from sliding too far backward under the femur. A classic way this gets injured, and you'll hear this a lot, is a dashboard injury in a car crash, where the knee smashes into the dashboard, forcing the shin bone backward.
Okay, just one more quick film before we leave the joint proper. We have to mention the bursa. These are these little, almost like tiny water balloons, these fluid-filled sacs that are strategically placed all around the knee. Their only job is to reduce friction. You'll find them anywhere a tendon or a muscle might rub against the bone. They really are the unsung heroes that keep everything gliding smoothly without irritation. All right, so we've spent a lot of time on the inside of the knee joint. Now, let's kind of flip the whole thing over and look at the space behind it. This area is known as the Popliteal Fossa, and it's not just empty space. Think of it as a major anatomical highway, a crucial tunnel that allows all the important nerves and blood vessels to get from the thigh down into the lower leg.
And you can picture this fossa pretty easily. It's a diamond-shaped space. So what makes the borders of this diamond? Well, it's all muscles. The top part is formed by your hamstring muscles, and the bottom point of the diamond is formed by the two heads of your big calf muscle, the gastrocnemius. It's a really neat little anatomical landmark.
So why do we care so much about this little diamond-shaped pit? Well, it's all about what's passing through it. The contents of the fossa are absolutely critical. We're talking about the lifeline, the nerves and blood vessels that supply everything in your lower leg and your foot. Now, here's another thing that is super high yield, really important to remember. The contents of the fossa are arranged in a very specific order, from the deepest structure to the most superficial one. This order is not random, and you will be asked about it. Moving from deep, right up against the bone, to superficial, closer to the skin, the order is artery, then vein, then nerve.
Okay, let's start with the deepest one of all. That's the popliteal artery. This is basically just the femoral artery after it passes through the back of the thigh. Because it's pinned right up against the back of the femur, it's in a really vulnerable spot. If you have a serious knee dislocation, this artery can easily be damaged, which is a major emergency.
All right, moving one layer more superficially, right on top of the artery, you'll find the popliteal vein. These two, the artery and the vein, travel together pretty much everywhere. You'll often hear the term neurovascular bundle, which sounds complicated, but it just means the nerve, artery, and vein are all running together, kind of wrapped in the same connective tissue. The vein's job, of course, is to carry all that used, deoxygenated blood from the foot and lower leg back up toward the heart.
Okay, one more layer up, and now we get to the nerves. The main big nerve running right down the center of the fossa, sitting just superficial to the vein, is the tibial nerve. This is a huge branch of the sciatic nerve, and it's the one that's going to go on to power all the muscles in the back of your lower leg, your calf muscles.
And finally, the last major player in the fossa is the common fibular nerve. Now, this one is the most superficial of the bunch, and it's also the most lateral. It runs along the outer edge. And because it's so close to the surface and has to wrap around the head of the fibula bone on the side of the knee, it is incredibly exposed. In fact, this is the single most commonly injured nerve in the entire lower limb. A simple bump to the side of the knee can damage it. So there you have it. The next time you think about the knee, don't just picture a simple hinge. It's this incredibly elegant, complex system of cushions, ropes, and a super important neurovascular highway that keeps your entire lower leg functioning.